Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
So there was a collective memory of infectious diseases that because of the vaccines, we've completely eliminated over 30 years. So current parents have no concept at all of the impact of the diseases on the kids.
That is Dr. Scott Krugman. He is a fellow Johns Hopkins-trained pediatrician, and he's the dean of a regional medical school campus with the George Washington University School of Medicine. His passion for teaching about vaccine-preventable illnesses became abundantly evident when his Facebook posts about diphtheria, pertussis, polio, measles, etc. reached 10 to 15 million views each. So we are super excited to hear from him today and to have the pleasure of interviewing him. We hope you enjoy this two-part series on vaccines with Dr. Krugman. Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Let's start with measles. So I have the Texas Department of State Health Services. They declared the measles outbreak in West Texas to be over in August, and they released the stats. They said 762 people had confirmed measles, 100 were hospitalized, 2 children in Texas died. They were both they were both school age. They were both unimmunized. And then there was 1 adult neighboring in New Mexico who also died. And, obviously any childhood death is tragic. And that 2 out of the 762 we would consider a high number. I think the number that people don't talk about a lot, 100 were hospitalized. And when I think about the course of my career, I've practiced both in the community hospital setting and the large children's hospital setting. And I don't take children being admitted to the hospital lightly, right? Like we can help parents manage a lot of illness at home very, very safely. If you're admitted to the hospital, we believe that something is potentially life-threatening if we aren't intervening to give you support, right? Like this is a significant step to admit to the hospital. So that's roughly 1 in 7. So let's talk a little bit about measles. Like what is it that causes kids to be that sick with measles?
Yeah, I first want to echo and second that completely. The number of kids who don't end up in the hospital, who are very sick with an illness, like even if you look at RSV and flu, there's a lot of kids who are very sick with those things and they're at home lying around like dish rags or breathing fast, but they're not in the hospital. So it takes a lot to get into the door, right? So you do have to be very sick. And measles itself is causing very high fevers, which can cause brain inflammation and seizures. It's causing kids to just be completely miserable and become dehydrated because they cannot, they just can't get enough in. And it's causing, it can cause secondary pneumonias, just like flu can cause secondary pneumonias. So, and the measles virus itself can go down there, or there can be secondary pneumonias, and that can cause respiratory distress. All of those things can put kids into the hospital and make them very, very sick.
So measles is part of the MMR vaccine. It's the first in the MMR vaccine, measles, mumps, and rubella. And it's given for the first time at the 12-month physical and again at the 4-year-old physical. The measles virus is exceptionally contagious. In fact, it's often referred to as the canary in the coal mine.
Yeah, so it's really interesting when you think of that phrase, the canary in the coal mine, like the etymology of that phrase, it's actually from way before we had carbon monoxide detectors and other detectors for dangerous gases in the air. Coal miners could take a canary down into the coal mine, and if the levels of carbon monoxide rose to dangerous levels, they would know because the canary would die because it has such a high metabolic rate. So I think that image is a really good one for this. When you see measles outbreaks, like the one that we saw in West Texas in early 2025, that's a sign that our shield of protection is wearing thin. In other words, the canary is dying, right? Like we're starting to see that shield wearing thin, and measles is going to be the harbinger of what's to come because of its incredibly high contagiousness.
What I know about measles is that measles is so contagious that if you have a child that has measles, coming to see you in the office, and they're in the waiting room before, you know, they're being brought back, and they leave the office. A child that comes into that waiting room 2 hours later, after the first child had left, can still contract measles from the pathogens that are still in the air 2 hours before. So that's kind of like an image of how contagious measles can actually be.
Yeah, that's really crazy. I mean, most viruses by far are not like that. That we know that like after the virus is spread to some kind of surface or coughed into the air, it's a matter of like minutes,
Right.
before the virus dies. Like
Yeah.
this is really an outlier, and that's what makes it so incredibly contagious.
Yeah. And I think a lot of people will remember the 6 feet for COVID, right? Like if you were 6 feet away, then, you were safe. That was the kind of distance that COVID could spread. We're talking 2 hours after someone had left a space. That is highly,
Yeah.
highly contagious.
That's like a nightmare for schools and offices, all of
Right.
the things you can think
Right.
of.
And you can imagine if someone is flying on an airplane and has the measles, pretty much everyone on that flight has now been exposed. And if you're not immunized or you don't have natural immunity, which a lot of people don't, then those people will contract measles, right?
Yeah, and obviously, as we discussed in this interview with Dr. Krugman, measles had a very high rate of not only mortality, but also complications.
Yeah.
So we talked about that 100 children hospitalized in Texas. So measles is more than just a rash that people think of. It's a very significant viral illness that is absolutely life-threatening, often requires hospitalization, and is absolutely vaccine preventable.
Right.
And what we don't know is what's going to happen 10 years from now. How many of those kids are going to end up with SSPE or the brain inflammation that is fatal, right? So
Right.
There's still risk for those 700 kids who made it, and the ones who weren't hospitalized or were hospitalized, they still are at risk of a really, really severe outcome. That all of these things, just to circle back, are 100% preventable.
Yeah.
We had 0 cases of measles in the early 2000s. We did not see this disease for almost a decade.
You tell our listeners more about that SSBE, the secondary effect of measles. What is that, and what does it look like?
Yeah, so it's a progressive neurological disorder where the virus, I'm not 100% sure if it's an autoimmune reactivation of the virus. I think it's more of an autoimmune type encephalitis, but the brain then starts to melt upon itself. And if you want a good description of it, Roald Dahl, the author of Charlie and the Chocolate Factory, his daughter had that condition, and he wrote a very nice essay about it.
Really?
And it is it's horrendous. It's just it's a horrendous progressive neurology. It's not that common, but you don't get it from the vaccine. You only get it if you had measles. So it's why put your child at risk?
And even if you had a mild case of
Correct.
the measles, you're still at risk for this secondary inflammatory is it an encephalitis or neuropathy?
Yeah, subacute sclerosing panencephalitis.
So, of course, when Dr. Krugman mentioned this subacute sclerosing panencephalitis and Roald Dahl, I had to go back and look up that essay. I did not know about this until he mentioned it, even though I have the whole Roald Dahl set at my house. I mean, he's such a well-beloved children's author, but he did, you can find it online. He wrote an essay in 1986 entitled Measles, a Dangerous Illness. And he's looking back decades earlier, before the measles vaccine, about what happened to his daughter. And this was an essay he wrote trying to explain the dangers of not vaccinating against measles. And this is what he says. Olivia, my eldest daughter, caught measles when she was 7 years old. As the illness took its usual course, I can remember reading to her often in bed and not feeling particularly alarmed about it. Then one morning, when she was well on the road to recovery, I was sitting on her bed showing her how to fashion little animals out of colored pipe cleaners. And when it came to her turn to make one herself, I noticed that her fingers and her mind were not working together, and she couldn't do anything. Are you feeling all right? I asked her. I feel all sleepy, she said. In an hour, she was unconscious. In 12 hours, she was dead. The measles had turned into a terrible thing called measles encephalitis. There was nothing the doctors could do to save her. I mean, this is a nightmare for parents, right? You're seeing your child start to get better from the measles, and then all of a sudden develop these odd symptoms, and then go from seeming to get better to dead in 12 hours, right?
I can't even imagine.
Yeah, it's just heart-wrenching. He goes on to say, I know how happy she would be if only she could know that her death had helped to save a good deal of illness and death among other children. And I want to make a point. He wrote this in 1986, so, roughly 40 years ago. And he's making the point that when these things occur, this measles encephalitis, this subacute sclerosing panencephalitis, like Dr. Krugman was describing, that's a complication that shows up days to weeks to months to years after the measles infection. And even though Roald Dahl was writing this 40 years ago, it's still the same today that we do not have a treatment that takes that away.
Yeah.
I mean, we can give our best medical support in the hospital, in the intensive care unit, but it's not something that we can necessarily cure. And again, this is absolutely vaccine preventable.
Right.
So measles, that was a generation before you and I, Sylvia. Very few pediatricians in my career have seen cases of measles unless they happen to be practicing in an area where there was an outbreak. Now we are going to go back even further in time.
Right, to the 1920s. And we're going to highlight an illness called diphtheria, which was actually a public health crisis due to its high contagiousness as well, difficulty treating, and high death rate. So diphtheria was a pretty nasty one back in the 1920s. And during that era, there was an estimated 15,000 deaths per year in the United States, mostly children dying from diphtheria.
Diphtheria is the D in the DTaP, often referred to as the DTaP vaccine, which is given in infancy, and people may be familiar with it also being given as a booster every decade or so later in life.
Yes, and that one's called the Tdap vaccine. So similar, but not the same.
Okay, the other one that people don't think about a lot is diphtheria.
Yeah,
Because-
I definitely think that's true. I do not think about diphtheria very much.
I do not think about diphtheria in my practice, right? Because, back in the 30s, they came up with the diphtheria toxoid and you could get that injected to save you. But again, that was a time thing. You had to get it in. And then there were antibiotics, but it's the toxin that causes the problem. So even if you get the antibiotics in, the toxin can still be out there. And this is a disease that literally there's a membrane that grows over your tonsils into your airway and you can't breathe and you die. Like, that doesn't sound good at all. And the pictures really are quite gross if you want to look at them. And this is gross enough that Facebook blacked them out, right? That's how gross they are. So,
when you posted it, did Facebook black them out? You're kidding, really?
Sensitive content. So it tells you how bad it is, right? So it is not a good disease. And literally this disease does not need to exist, but there are pockets in the world where it exists and it can come back quickly. And when we stop vaccinating, it will come back. And it's another one where, I'll just get antibiotics and toxin. You might, but you might not have time, right? Like literally the whole Iditarod story started because of getting diphtheria toxoid by the dogs mushing to the rural area in Barrow to get the toxoid to them. And they had to go as fast as they could to get it there in time to save the kid's life.
This is the story of Balto that he is talking about.
Right.
So every homeschooling curriculum I have ever looked at when I was homeschooling includes this story because kids, of course, love stories where the dog gets to be the hero. So, if you're not familiar, Balto was the lead sled dog for a team of dogs racing against time through a blizzard to get the antitoxin for diphtheria to a remote town in Alaska where children were dying from an outbreak of diphtheria.
Balto is not only memorialized in children's literature, but I actually did my medical school in New York City. And in Central Park in New York City, there is a statue of Balto right there in the middle of the park, memorialized for his heroic efforts to prevent this child from dying in the story.
Yeah, so cool. It just makes the point of what a big deal this was to try to treat diphtheria. And the problem with diphtheria is that the bacteria itself causes an inflammation to the mucous membranes. That's all the membranes lining like the inside of the mouth, the throat, the esophagus, the trachea. And of course, that can interfere with breathing. But in addition to that, this bacteria releases a toxin into the bloodstream that can cause damage to the heart and to other organs. So it's not as simple as just giving an antibiotic to treat diphtheria like we do with most bacterial illnesses, because once that toxin has been released, you actually also need to treat with the antitoxin. And incidentally, I did look up those pictures Dr. Krugman was talking about, and we'll place links in the show notes. But just to kind of describe it for you, when you open your mouth and say, you kind of expect to see this pink throat with maybe a little bit of tonsil on either side, and you probably see the uvula that hangs down in the back. And if you can imagine, a child with diphtheria opens their mouth and it's like you see that, but it's covered with this white curtain of this like pussy substance that can be completely blocking the hole going down to the airway. So they are pretty gross pictures, even to a physician.
Yeah, we'll put a post on the show notes so people can see what we're describing.
We never thought about diphtheria. We never thought about tetanus. We never thought about polio. Like, these things had been eliminated the generation before of us. So like my dad is a pediatrician, and his generation dealt with a ton of measles, a ton of chickenpox. They were at the end of they were still treating post-polio syndrome kids, right, in the 60s and 70s. So it was still present, but there wasn't the disease that they had to worry about. But my grandfather, who was a pediatrician, he was dealing with all of these things and saw it from the very beginning. And there's a reason why we had such an explosion of infectious disease treatments and vaccines in the 40s and 50s and 60s, because it was really bad. And a lot of effort post-war went into making these things go away. They did a great job.
Dr. Krugman mentioned the post-war effort, and it caused us to go back and look at the history of vaccine development. And sure enough, in the 1940s, 1950s, and 60s, we saw this incredible push in vaccine development in the United States. And a significant part of that was the desperation to improve child mortality. In the 1900s, 1 in 10 children under the age of 1 died before their first birthday. That's 10% of children died before their first birthday. And then in the children under the age of 5, that accounted for 30% of all deaths.
Yeah. So childhood death was like, it was almost expected, right?
Yeah.
In these generations in that turn of the century in the 1900s. And for me personally, I have a lot of family lines where the genealogy has been really well done. And I have this app I can pull up and like trace the lines back. And I can follow it back and see in my grandfather's generation, my great-grandparents' generation, this idea of like, oh yeah, sure enough, there were multiple siblings that died, under age 5. It was it was almost just expected. I can see it. This was real. This was real hardship. And a large percent of that was caused by infectious disease or caused by now vaccine-preventable illnesses. So this was a major push in those decades to try to solve this problem of this, high prevalence of childhood mortality. And the WHO, the World Health Organization, when they started their sort of worldwide mandate on vaccines, making them more globally available, they estimate that since 1975 or so about 50 years, 154 million lives have been saved globally. And here's the part of that statistic that is so important for our discussion. 95% of those have been children under the age of 5. So when Dr. Krugman speaks about that incredible push post-war to develop vaccines and the huge success of that, this was really considered a golden age of vaccine development. And people saw this tremendous shift in childhood mortality going down as a result.
So I think my approach often centers around the fact that the vaccines have been developed for a reason. They've been developed to prevent specific diseases at specific ages, and they were tested around these with the safety and outcomes and efficacy and all those things. But the bottom line is, I reassure parents that millions and millions of kids are getting these vaccines, and we are not seeing kids with these diseases, period. And we really rarely see severe side effects. For the most part, the way that the vaccines have been tailored and developed over the years has really decreased the amount of immunogenicity and adverse effects.
I feel like there's this principle in parenting where obviously the whole point of this is that parents are under pressure. Parenting is very stressful. And I feel like there's this thing in my decision making with parenting of like, well, what can I control and what can I not control? Okay. So like I can control whether or not my child gets the measles or, invasive Hib or like invasive strep pneumococcus. I can control that by doing the vaccine. There are a lot of things in parenting that I cannot control, like what's going to happen when they get social media, all of these things. So I like to think about the things that are within my control that I can act on, and let's do that. And the things that aren't within my control, okay, well, let's mitigate that and take off some of the stress. But I hate to put these things that are well within my control back on the plate of another additional stressor in parenting, right?
I think that's a really interesting frame for combating the anxiety, right? Because what makes parents anxious? The uncertainty, right?
Yeah.
Uncertainty, like, is my child going to have a tantrum in Walmart or not? Is he going to eat anything besides chicken nuggets? Those cause anxiety, right? These are common things that cause a lot of anxiety. And where we have the anxiety being pushed onto parents is from vaccines are bad, vaccines cause this, vaccines are doing bad things. When really it's the complete opposite. Mm-hmm. The anxiety really should be around my child getting these illnesses, right? Because these illnesses are going to be way more stressful and way more anxiety provoking than any possible side effect from these vaccines. And
yes.
I want to put it on the record in case anybody out there says it. I don't get paid any more for vaccinating. I don't get paid by any pharmaceutical companies. I don't know any pediatricians who are driving Mercedes-Benz and millionaires because they are giving vaccines. All of this is complete mythology. And literally, if you could, you can tell from our voices, we actually care about kids and really don't want them to get sick and die.
Right.
And no child should die a preventable death. And a lot of us have spent our careers trying to prevent that from happening.
No, that's really well said. I want to thank Dr. Krugman for being our special guest on today's show. So as we've listened to this interview, I want to leave you with a few concluding thoughts. As professionals who have spent decades taking care of children, and as parents raising our own children, we want you to know that we absolutely feel vaccines are safe and the risks of not vaccinating your children far outweigh any possible side effect associated with vaccines.
We can come to this conclusion from the many scientific studies that have looked at hundreds of thousands of children, comparing vaccinated and unvaccinated populations, and finding that the incidence or the rate of things like autism is the same in both groups.
In addition, we have the Vaccine Adverse Event Reporting System, or VAERS, and the Vaccine Safety Data Link, or VSD, and these systems report and investigate any type of vaccine adverse event that we may not already know about. That is the way we monitor the safety of vaccines. It is our firm recommendation that immunizing your child according to the American Academy of Pediatrics, or AAP guidelines, is one of the most important things you can do to protect your child's health. You've been listening to one part in our vaccine series. If it is helpful, please listen to our other episodes for a more complete picture of vaccines. We encourage you to continue this discussion with your primary care provider.
This is 10 Kids, 2 Docs. I'm Dr. Vivian Carlin.
And I'm Dr. Sylvia Bank. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.